Revising the problem list. The first task of the Kaizen team was to make sense of the list of problems developed by the entire clinic staff. Fortunately, many of the problems were duplicates, as different team members identified the same problems. In many cases, they were related. So the team put all of the duplicate problems together and then began to group the other problems by related or similar topics. This is called affinity grouping. After grouping like problems, a diagram can be made of the groups. With problems that seem similar or seem to overlap multiple areas or groups, decisions need to be made about which group to put them in. Based on the number of people who submitted problems within a group, the groups can then be prioritized. A wise Kaizen group will look at multiple factors at once to set priorities, but only tackle one or a limited number of problems at a time. Now, there are models of improvement for which a nearly unlimited number of issues can be addressed. They can be effective, but oftentimes only superficially address problems with much deeper layers, or they introduce interventions too complex to be implemented effectively. The input gathered from the customer and patient surveys was then compared with the data brought forward from the team meeting. As is frequently the case, the problems identified by patients and families were related to, but different than the problems identified by the staff. It's interesting to note at this point the difference between a problem and a cause. During the team meeting, multiple staff expressed that they felt there were not enough people, not enough staff available for the work that needed to be done. This is theorizing about a cause and probably one of the most common complaints in any workforce. But what's the actual problem? It may be the stress that individuals feel. It may be a requirement of overtime or not going home on time that destroys work-life balance. It may be frustration over a real or perceived problem with the quality of care that's being delivered. But what really needs to be outlined is not potential causes of problems, but the actual problems themselves. What is the problem to be addressed?